Hello, everyone. Welcome back to Therapy Thursdays. It's May 16th. This is week 2 of the 2024 Mental Health Awareness Month. And I'm partnering with the Henrietta Weill Memorial Child Guidance Clinic out of Delano office. And we're having clinicians come on to talk about different topics every Thursday this month. And today we're going to be talking about women's health specifically. And I'm going to bring on our clinician for today. Everybody, this is Tove Scherson, and she's going to guide us through this conversation, and I'll pop in with questions as they come up for me, and hopefully will be helpful to all the people that are watching. Tove, please share what brought you to this field and then how long you've been there in Delano, please.
Yeah, so my name is Tove Scherson. I've been a therapist for about, 7 years now, I believe. I've started working at Child Guidance Clinic back in 2022. Before that, I worked for the county. I worked with adults. And what got me into the mental health field really was, I would say, my own therapy. So seeing how much my own therapy helped me overcome past things and really get me to where I am. I really struggled with intense anxiety in my undergraduate years, and therapy just really helped me cope with that and overcome a lot to get to where I am today. So I decided, I'd love to go on and help someone else, accomplish their dreams.
And then what led you to the clinic in Delano?
I would say I heard a lot of really great things about it. So in Kern County, Kern County is Bakersfield's a small, big town. And so I had heard such great things about child guidance, and I got offered an opportunity to work in Delano. And I had actually never been to Delano before. And so I was like, hey, I'll go work in Delano. And I'm so glad I chose Delano because I absolutely love the community. I can't see myself working anywhere else.
Awesome. That commitment comes through in your work, I'm sure. Okay. Now we are going to present some information. So let me pull this up. Okay. All right. So whenever you're ready.
All right, so I'm going to be going over some information for Women's Health Month. I'll be going over mental health and women, the relationship between women's physical health and mental health, how to take care of yourself, and some resources. So this is going to be, some of this information will also, it pertains to men, but most of this is for women. So obviously mental health and physical health are connected. The better you take care of your physical health, the better your mental health is going to be, and vice versa. So 1 in 5 women in the United States has a mental health problem. So anxiety, depression, eating disorder. And more than twice as many women as men have been diagnosed with anxiety. And so some of the more common disorders, mental health disorders, women experience are depression, anxiety, and eating disorders. However, I will say that, I'm not sure if it's due to the fact that women are more likely to seek out mental health services, but I think we're seeing these numbers rise in men. And so I'm going to talk about 3 distinct disorders that are unique to women. And these disorders, I think they're so important because they're not really often talked about. So the first one is perinatal depression. And this is something that occurs during pregnancy or after pregnancy, so after childbirth. And it's something that I think maybe people get confused with the baby blues. So it's more than just the baby blues. It is an extreme sadness, anxiety, fatigue. Um, women might find themselves having difficulty carrying out tasks that were maybe like easy, or um, maybe tasks they never really had to think about before. Now suddenly they find themselves not able to carry out these tasks, or they're becoming really burdensome. And so again, it's more than the baby blues. The next one is premenstrual dysphoric disorder, or PMDD for short. And this is a more intense form of PMS. This occurs in the weeks before menstruation begins, and it causes some pretty severe symptoms, pretty severe anxiety, depression, irritability, agitation, appetite changes, bloating, joint or muscle pain. So you even get some of those more, it's not just mental health, it's also physical symptoms. And then I have perimenopausal depression. And this doesn't affect all women, but it affects quite a few women during the transition to menopause. So you have abnormal periods, mood changes, issues with sleep, hot flashes, irritability, sadness. So again, a lot of those depressive symptoms and anxiety symptoms. And so all those relate really, a lot of, they're a combination of mental health and also physical health related.
Do you know or have an idea of how difficult it is? Well, first to maybe get a diagnosis, and then what treatment options are available, if any, for any of these?
With the perinatal depression, I think that's something that more care providers are looking for nowadays, just because mental health has now become such a big part of society, and people are really seeking out services. And I think even, I think also more so with doctors, with medical doctors, I think nowadays they're on the lookout more for these mental health symptoms. And so, something like that definitely, I think, needs to be under the treatment of, when I'm talking about perinatal depression, needs to be under the treatment of like an OB or a PCP, and as well as seeing a therapist. And then PMDD, I can't remember exactly. I know I've had a couple clients with this disorder. Therapy helps, and I can't remember if medication is recommended. And with perimenopausal, I believe that is something that's going to be more related to like that hormonal imbalance. And so if you target maybe the hormonal imbalance as well as therapy, that can help.
Yeah. I think you make a good point about maybe in the medical fields being more aware that these things are, everyone knows they're stigmatized. I feel like maybe the thing is that patients can be more aware that they can ask about these things. Because how cool would it be? Because I'm thinking about if I'm going for like an annual exam, or I'm pregnant and I'm going to go see a doctor, if that can be part of like the conversation. And I know right after COVID, I think at my OBGYN, there was this extra sheet. And I don't know if everybody who has gone to the doctor lately, or maybe it's only specific doctors, where you start answering questions about mental health. And I don't know it's like a stereotypical sort of intake that just happens maybe like at a therapist's office, but it was
Mhm.
an extra thing that I had never seen before the pandemic. And it was
Mhm.
specifically about like my emotional state and that kind of thing. So I thought that was interesting. And so hopefully at my doctor, that is something that they're paying attention to. Um, I'm just going to comment on the perimenopausal depression side of it. I recently started hormone replacement therapy, so I'm hoping.
Mm.
I feel like I think it's better. Things are so crazy all the time; it's hard to gauge. Um, so I should keep track, but
Mhm.
I feel like there's a little bit more, if nothing else, some sense of clarity and calm that I'm still, I have ADHD also, so I feel like there's a lot of other stuff that interferes with that. But I think that part of it, if I do start to worry about something, I'm able to kind of like not overthink, I think is the thing that is changing. So
Yeah.
I don't know.
Yeah.
Yay. But it was hard to get it. It was hard to get
Oh.
access to it, and I'll say for
Wow.
me, it took me so long, and I know we're going off a little bit, but I mean, it's women's health, and I'm a woman. Um, I had to keep changing my appointment with my OBGYN. I'm like, I can't keep waiting like 2 months and 2 months, like, first I
Wow.
canceled and then they canceled, and it was like 2 months out every time I had to reschedule. So finally I went online. I did telehealth, and I was able to get
Mhm.
a patch for
Mhm.
estrogen. So I mean, it's
Yeah.
working. That's what, I can kind of afford it. So I think access is probably another thing that we
Yeah, I
should all be.
agree. Access and, like 2 months is a really long time, especially if you're suffering. Especially if, you're suffering, whether that's physical pain or mental health wise, that is a really long time and it can be so life impairing.
Yeah,
Um, and these things, if you're suffering with these, they will affect every aspect of your life.
for sure.
So yeah, accessibility is definitely an issue, and I'm so thankful now we have telehealth where we can see a doctor in our home. It makes it so
Hmm.
much easier.
Do you guys provide services that way also?
Um, yes and no. Mostly our telehealth services are with the psychiatrist.
Mm,
Once in a while we'll do Zoom. That's if like we really need to. If someone can't come to the office or if we can't go to the home or school, we'll do Zoom. But not really so much. Not like the further we get away from like um, coming back into the office. I don't want to say post COVID, but post
yeah.
quarantine, the less telehealth I notice we're doing.
Okay. Okay, we're gonna jump back in. Thanks for that.
Mm-hmm. All right. So I'm going to be going over the relationship between women's physical health and mental health. So I kind of went over that in it's the last part of the slide, but um, there's a lot of other factors that contribute to our mental health well-being and our physical health. We have genetics. So if you have a family member that maybe has been diagnosed with depression, anxiety, bipolar disorder, schizophrenia, or a psychotic disorder, you're more likely to be diagnosed with those, whether it's genetics or environmental. We have low motivation. So some of the mental health problems or medications can affect your motivation. So when we have low motivation, whether it's from a medication or whether it's from a mental health symptom, it makes it difficult to engage in life. It makes it difficult to do anything. Um, Difficulty with concentration and planning. Again, you get a lot of difficulty with concentration with depression. Maybe if you have ADHD, like that can be a really big one, is difficulty concentrating, staying on task. Um, planning. I know I have ADHD and I have difficulty with that. It takes a lot of willpower to stay on track.
Yes.
Um, Lack of support to change unhealthy behaviors. So, you know, studies show that we're more likely to do well with our health, whether it's mental health or physical health, if we have support, if we have a support system, even one person in our life who is supporting us and supporting our choices and what we're doing. And lastly, being less likely to receive medical help. So kind of like what we were talking about earlier is, accessibility to help. Do you live in a region where you can see a therapist or a medical doctor or a psychiatrist? A lot of regions, especially with psychiatry, a lot of regions maybe, don't have a psychiatrist, or maybe they have a lack of psychiatrists. So being able to receive that care.
I'm going to mention this because I'm trying to tell as many people as possible about this, because this idea of the lack of support to change unhealthy behavior. When you say like at least having one person, I know there's a lot of conversation with that when we talk about education and kids having at least one adult to champion, right? To advocate for them or to make them feel like they can be successful. This is like across the board, researched, all of that. But I don't know if you're familiar with Simon Sinek, but there's been a few videos recently where he talks about this 8-minute, not rule, but this 8-minute idea for reaching out to people. So if instead of saying like I need help or can I call you, or texting, how is somebody doing, you either can set up like with your friends and family or people who you trust that will be there for you for at least 8 minutes. That 8 minute, for some reason, that might be the magic number where you're checking in. And I talked to my friend about this, and I recently did it. I texted her and I said, "Do you have 8 minutes?" And it was like a quick phone call. I just needed to check in, like I need to get something off my chest. And then she talked to me real quick, and it was just like I just needed something, get off my chest, check in with another human being, and that was enough. That was enough for me in that situation, that the rest of the day I felt better. So yeah, and so even if it's just one person, or maybe you don't need it that often, but I feel like if you have that support.
Yes.
And specifically the slide is about changing unhealthy behavior, but to me, that might be keeping somebody off of social media. It could deter from harmful behavior. It could deter from, self-medicate, whatever it is. 8 minutes. I want to, every time I have the opportunity, I'm going to tell people, you know what? It just takes 8 minutes. So if you want to check in with somebody, check in with me if you need 8 minutes.
Yeah, I have never heard of that, but I will look that up. I think that's an awesome idea.
Yeah, Simon Sinek. And there's more than one video. I think he's been talking about it like across various interviews. So it's like, hopefully that's something that catches on, because sometimes when we say we need to talk, it's like, is it going to take 20 minutes? I don't have time. But if I ask a friend 8 minutes, then that could be doable.
Yeah. Okay. Yeah, definitely. So taking care of yourself, gosh, why is this one so difficult? Sometimes I feel a bit like a hypocrite, as a therapist, like telling my clients like, oh, exercise, eating right, get enough sleep, do, meditation. And I'm like, oh, I don't even do those, but I try. It's all about trying, right? And so for the first one, getting regular exercise. And I think this is something at the doctor's office, they ask you about like, how often are you exercising, and like for how long? And because it gets repetitive, but it is so important, not just to exercise for your physical health, but for your mental health. It really does make you feel so much better. Like personally, I notice when I exercise, I've recently taken up jogging, and I sleep better. I sleep actually less. I sleep less. I have so much more energy. And I just overall I feel better. My mental health is better. I get through the day easier. Like, when I'm not exercising, I feel like I need a nap midway through. And when I'm jogging, I don't. So really, exercise is such a huge part of not just our physical health, but our mental health. Also, eating a proper diet and hydrating. That's a tough one. Eating a proper diet. I don't know if you've ever felt the difference, like maybe between like different things that you eat, but I know like if I eat, fast food or something that's heavier, I definitely feel it. I feel sluggish. My brain is slow. And with water, I think water is one I'm pretty good with. I try to drink throughout the day, but water, I notice I have a lot of clients who, when I ask about their water intake, it's like almost nothing. And they come in with tons of anxiety. And I say, like, maybe try drinking some water. And it really does, it really helps a lot.
Wow.
Of course, avoiding alcohol and drugs. Although those things can help in the short term and the long term, they really mess us up. Getting enough sleep, as I mentioned. I think the good night's sleep is around 7 to 9 hours for adults. And then they recommend if you're going to take a nap, don't take a nap longer. I think it's like 20 to 30 minutes at a time, or else it messes up your circadian rhythm. Also relaxation techniques, so mindfulness, deep breathing. They have a lot of those like really great apps for free that you can get through like the app stores. Develop good mental health practices. So focusing on positive emotions or seeking help from others, whether that's your friends, your family, professional help. These are all part of taking care of yourself.
Mm-hmm. And I feel like I think that they're mostly common sense things that all of us keep hearing. Yeah. I mean, we've been hearing this so often. I do think that maybe as communities, we're not as supportive as we could be in a lot of these. And I'm saying that because it's not about gym culture. It's not about going to the gym and making sure that there's a space. It's just like, how are we figuring out ways so that families can get some kind of movement, no matter what ages they are, and then getting outside more? Because we know, I mean, you mentioned circadian rhythm. So I know that if I'm going to be home, like today's a perfect example, actually. I think I went outside for 5 minutes to check the mailbox, and then I did not spend any other time outside. I'm going to do that when we get off this call. Yeah, I'm going to go outside, especially in the morning, right? Getting that morning sun. So we keep hearing about it, and there's such simple things, and we just feel like we don't have the time to do it. But it's like that, having those practices built into the day. We expect kids to go by this schedule that we built for them, but we don't do it for ourselves. So,
right. Yes. Yes. So I included a little snapshot. It's from, I think it's the National Institute of Mental Health, so a government organization, just going over mental health. So, I think a lot of people wonder, like, do I need help? Like, am I just sad, or is this something more than sadness? Like, should I go to a professional? Should I see a therapist, a psychiatrist? So it goes over some of the symptoms, whether or not are they lasting for at least 2 weeks. Goes over some of those, again, self-care activities you can do. And then, when you should seek professional help. So maybe if someone wants to look at the little snapshot there, that might be helpful. And lastly, I've included some resources. There's the SAMHSA National Helpline, this 24/7, 365. I believe these are all in English and Spanish. We have the 988 Suicide and Crisis Lifeline, so you can call or text, again, English or Spanish, and they'll connect you to a counselor with the National Suicide Prevention Lifeline Network. This one I really like, the crisis text line. So I love the fact that now they have made it to where people can text for help. And I love that because unfortunately, what I've seen, due to the quarantine is so many people have social anxiety and like it has just skyrocketed, and things that we might take for granted, they struggle with. So picking up the phone and calling and talking to someone can be too much for someone. And especially if you're in a crisis, if you are, at the point where maybe you're suicidal, you're having suicidal thoughts, and you already you feel like you can't talk to someone, like it's going to make it really difficult to pick up that phone and verbally tell someone what's going on. So I really like the crisis text line. I think that opens up the service to a lot of people. And lastly, I have the Kern Behavioral Health and Recovery Services, their 24-hour crisis hotline as well. So a lot of really good resources for people out there who are struggling.
Yeah, that's good that adding that local, and I didn't realize that was 24 hours actually.
Mm-hmm. Yeah, I think they all are.
Okay. So I know we were talking about women's health. Is there anything else that you'd like to share about maybe statistics, or maybe there's something local in terms of where to find additional help because I know that you're at the Child Guidance Clinic in Delano, and there are services outside of Delano. I don't know in the area if there are specific places where you would recommend, like if you know that adults, the guardians or the adults that are in your clients' lives or other people, do you have recommendations locally?
So for mental health for adults, for Delano, I generally recommend next door we have Clinica Sierra Vista. We have their adult behavioral health services. They also have a substance use program for both kids and adults. So they will do treatment for substance use there as well. So I often recommend parents like, hey, if I think the parent getting mental health treatment is going to benefit the child, I'm going to recommend them to go to Clinica. And in terms of like health, like physical health wise, medical doctors, again, like right next to us, we have Clinica. I think there's Omni, and then there's Gloria Nelson Center, but I'm not sure if they see adults or just children. I'm not too familiar with them, but I've heard really great things about Gloria Nelson Center.
Great. Okay, so I'm going to put up the website here because the clinic is a nonprofit. So this is where you can go find out different programs throughout Kern County, and then also donate. I know they've had a gala. I don't know if they've had one recently, but so they work for, you guys work through the county, but then you also need funding. So if you're going to donate, this is a good place. This is a good place to do that, because a lot of great programming, obviously, and then working with the schools locally, and then now making sure that when your clients come in, that the adults involved in your clients' lives can also be referred or have access to services. So thank you so much for sharing this information on week 2 of mental health awareness. Well, it's actually week 3, but we've only been doing it for 2 weeks. May is long. I'm always like, oh, it's always 5 weeks. Okay. So thank you so much for coming on and doing this. I know you guys, you work hard, and this is after hours, and I appreciate you so much. Thank you, and maybe we can do this again.
Yeah, thank you for having me. I appreciate it.
Okay. See you next week, everybody.